On this edition of Veterans Health Watch, we'll learn about the VA's research on Aeromonas, a bacterium found in all types of fresh and brackish water, and advice on how to prevent the infections it may cause.
We'll also learn about the Million Veterans Program, a national voluntary study designed to look at how genes and DNA affect health and illness.
Welcome to Veterans Health Watch, a program sponsored by the VA Maryland Healthcare System that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm Kenya Griffin.
And I'm Chris Buser.
Well, if you've watched the news lately, I'm sure you've heard about the bacterium Aeromonas, which naturally occurs in all types of fresh and brackish water, but can cause issues for humans in certain conditions. And joining us today to describe Aeromonas is Dr. Amy Horniman, the Chief of Microbiology and Molecular Diagnostics at the VA Maryland Healthcare System and an Associate Professor at the University of Maryland School of Medicine. Thank you so much for joining us, Dr. Horniman.
Thank you for having me.
So, as I mentioned, Aeromonas, could you tell us more about this bacterium?
Yes, this organism has gotten a lot of media attention lately with the cases in the news of necrotizing fasciitis. And I always called it the Rodney Dangerfield of bacteria because it didn't get respect. But it naturally occurs in fresh and brackish waters like the Chesapeake Bay that are a mixture of salt and fresh water. And it belongs there. It's a part of the aquatic ecosystem. But when we recreationally get into the water, expose ourselves to this organism. And therefore, it has the opportunity to cause human infections.
Mm-hmm. Dr. Horniman, how does it go about causing human infections?
Like I mentioned, it lives there normally in the water, doing important things for the ecosystem. And then when we go crabbing or boating or fishing and we sustain a wound in the water, or we get in the water with an open wound, or we accidentally ingest some of the water while we're swimming, the organism gets into our body, and certain strains of certain species of Aeromonas have the potential to cause a variety of diseases, ranging from a mild self-limiting diarrhea to a serious wound infection to the rare scenario of this rapidly fatal necrotizing fasciitis.
So who can develop infections from Aeromonas? Is anyone susceptible to it?
Anyone can. However, with a lot of bacterial diseases, the very young and the very old are more prone, because when we're first born, we're developing our good intact immune system. And as we age, our good intact immune system tends to fade on us. However, people that are recreationally active, normal, healthy, active adults, if they do sustain a serious enough wound and it's not dealt with properly, and Aeromonas is in the water, they can get a serious infection.
Dr. Horniman, what are the symptoms associated with an infection of Aeromonas?
Well, diarrhea doesn't need an explanation. Everybody knows what that is. And like I said, it's usually self-limiting. You don't need antibiotics and you get better in 2 or 3 days. But the wound infections are a little more serious. And whether it was Aeromonas or strep group A or E. coli, which everyone's familiar with, you would get a redness in the area, you would get swelling, you would often have a slight fever, and you may have some serious muscle pain. So all of these are signs that you need to get medical attention, and you need to get the wound cultured. So a microbiologist like myself can tell the doctor exactly what organism is growing there and exactly what antibiotic to treat with.
Are there any severe symptoms associated with Aeromonas and the infections?
When it goes to your bloodstream, as it does with other organisms, anytime you have bloodstream infections, they are life-threatening. And the doctor will draw blood cultures, and I will tell him what organism's in your blood and how to treat it. Or it could be a serious wound infection like we're talking about. And certain strains of Aeromonas, like certain strains of strep group A, cause necrotizing fasciitis, where they actually dissolve your flesh and your muscle and put you into total organ failure, and more often than not result in death.
So it's always best to act quickly and early.
Yes. Any wound you have, use the advice your mother taught you. Wash it out really good with soap and water. Keep it clean, put some antibiotic ointment on it, keep it bandaged, and if you see any of the signs of serious infection, then seek prompt medical attention.
So I've started to see some of these signs and I'm concerned. How is my doctor going to best diagnose and treat this?
The best way for a doctor to make any diagnosis, especially emergency room doctor, is a good medical history. It's important for him to know when you hurt yourself, how you hurt yourself, and where you hurt yourself. Because he or she makes a short list in their mind of certain organisms to start treating with while they're waiting for the cultures to grow up in the lab. So if he knows you have an aquatic wound infection, freshwater or brackish water, he's going to think Aeromonas. Whereas if it's salt water, like in the ocean, he's going to think Vibrio, which is a kissing cousin to Aeromonas. But each organism has its own unique group of antibiotics that are best to treat these infections with.
And for those folks who are or who do participate in recreational activities in the water, what tips can you offer for prevention?
Mainly just be very aware that you don't get into the water with open cuts, or that if you do sustain a cut, that you come out of the water and you clean it up and you take care of it. And if it starts to look nasty, that when you go to the medical facility, you let them know where you cut it and how you cut it. And the important take-home message is, before these cases in the news recently, everyone thought only necrotizing fasciitis was caused by strep group A. That's the organism that causes strep throat. And the drugs to treat that are things like amoxicillin, penicillin. We've all heard of that. My organism, Aeromonas, is totally resistant to those classes of antibiotics. So if the doctor knows you have necrotizing and you were in the water, he's going to think Aeromonas, and he's going to stay away from treating you with penicillin and amoxicillin. And the two drugs of choice he will use while he's waiting for culture results will be ciprofloxacin, and Septra, or Bactrim is another name.
Dr. Horniman, I'm sure our discussion today has brought up a lot of questions for folks out there watching. Where can they go to get additional information?
Well, if you actually go to the internet on Google, you can Google Aeromonas hydrophila. And if you Google my name as well, Amy Horniman, there's quite a few articles that I have done recently, the LA Times, the Baltimore Sun, the stuff I published in the University of Maryland. And I believe that they're going to be giving you a number as well for the Veterans Administration.
Well, thank you so much, Dr. Horniman, for joining us and giving us these great tips. We want our viewing audience to be safe.
Thank you for having me.
Yes, thank you so much.
Thank you.
We're going to take a short break right now, but when we return, we'll have information about the Million Veteran Program at the VA Maryland Healthcare System, so please stay tuned.
The VA Maryland healthcare system is a great system.
It's not your grandfather's VA.
We are a progressive and dynamic healthcare system.
And it's our mission to provide the highest quality healthcare to our veteran heroes.
Great programs, great technology, great staff.
And it's just touching to see how everybody just come together as one.
We do what we can to see that they get the best service.
It's a family. Nobody takes better care of you than family.
I'm Gary Sinise. It's a sad fact that some of our warriors, some of our nation's finest citizens, are wasting their lives through suicide. Suicide brings pain and heartbreak to your loved ones. VA cares about you. VA is reaching out to veterans who are thinking about suicide. So reach back now. Don't wait. Call 1-800-273-TALK and press 1. Our counselors will not share your information with anyone. Thousands of veterans have had the courage to call. How about you?
Those veterans who don't enroll in care, many times if you ask them if they're a vet, they'll say no, but I did serve in the military.
Anyone that made that commitment to put your life on the line for others is a veteran.
The system is very accessible. For instance, enrollment. We have 3 ways to enroll.
You can enroll online, you can physically go into the VA and enroll, or you can telephone to enroll.
It doesn't cost anything to enroll. All it takes is a few minutes of your time and a copy of your DD-214. That's all you need.
I'm a veteran myself. And I tell the family, when you entrust the care of your loved one to me, you can go home safe and very at ease.
Best thing that you can do is just come in and apply.
Without a doubt, any veteran definitely owes it to themselves to enroll. You know, your health and well-being is priceless.
Welcome back to Veterans Health Watch. Joining us now is Dr. Alan Scholdinger, the local site investigator for the Million Veteran Program at the VA Maryland Healthcare System and the Associate Dean of Personalized and Genomics Medicine at the University of Maryland School of Medicine. Dr. Scholdinger, thank you so much for joining us.
It's a pleasure to be here, Kenya.
Well, we know the Million Veteran Program is relatively new at the VA Maryland Healthcare System. I think it's been around for almost a year now. So could you describe to our viewing audience more about this program?
That's right. The Million Veterans Program is relatively new. It's actually a national research initiative, a voluntary research initiative. It's sponsored by the VA Genomic Medicine Program, which is a larger umbrella program in which we hope to bring genetic and genomics discoveries to new paradigms in patient care at the VA hospital.
Doctor, how long would a study of this magnitude run, and how do you determine how long it would go?
Well, this is one of the largest research initiatives that the VA has ever taken on. It's a multi-center trial, and it's going to go for about 5 to 7 years. And the reason it's such a long trial relative to other studies is that we need to amass about 1 million volunteers from the VA system, and we'll have 40 sites, 40 centers across the United States that will be enrolling these million veterans. At the Baltimore site, we're one of those 40 sites, and it's expected that we enroll 80 to 100 volunteers per week, and over the course of 5 to 7 years, ultimately about 20,000 veterans in Baltimore alone.
Doctor, you mentioned genetics. So how do the genes affect health?
Yes, so all of us have about 20 or 25,000 genes, and those genes are encoded in the cells within our body. They're on chromosomes, and the chromosomes are made of chemical building blocks called DNA. And as it turns out, most of humans' DNA are the same, but between different humans on the planet, there are many differences, and those differences in our genetic makeup is what determines the personal attributes of each individual human being. The color of our eyes, for example, how tall we are, and in addition, certain variations in our DNA actually determine how likely we are to potentially get diseases, common diseases, such as cardiovascular disease, diabetes, and cancer.
And I assume that's the goal of the Million Veteran Program, to determine how these genes kind of play out in our health and how we are affected by certain diseases.
That's exactly right. So now with the Human Genome Project, we know the exact sequence of human DNA, and we're able now to figure out which differences occur in people who have a disease compared to people who don't have the disease. And in that way, we're able to dissect specific variations in the genome that we know will predispose to disease, and then we can use that information to improve health care.
Awesome.
Dr. Scholdinger, why is it so important that veterans be involved in this study?
Well, one of the unique things about the VA system is that all of the hospitals are united into a single electronic health record. So there's a wealth of medical information that can be used not only for patient care as it's used today, but also can be harnessed for research discoveries. And then the idea of marrying the electronic health record with a DNA bank from literally 1 million veterans allows us to make discoveries at the VA that probably could not occur in any other healthcare system.
It's good to hear that the VA is using this to their advantage, this electronic medical record center, to the advantage of future veterans. And so how do you use, or how do you collect the information, how do you analyze it, and then what kind of studies are you conducting based on that information?
Yes, so the paradox of personalized medicine is that you need hundreds of thousands, even in this case, 1 million volunteers to make discoveries that make differences for a single patient. And the way this research is done is that the DNA can be analyzed, and we can determine which differences in the DNA occur more frequently in people with a given disease, for example, with diabetes or cardiovascular disease. And the differences that occur in the genomes of individuals with the disease compared to those without the disease allows us to pinpoint specific genes and the variations in those genes. And then we can use that information to understand more about the disease, potentially design new medications that are more effective for that disease in individual patients.
So it sounds like understanding, how the interplay between our veterans, their lifestyles, and their military experiences would be very important in determining how genes interact with our health and wellness. Can you explain a bit more about that?
Yes, that's exactly right. So it's of course not just the genes that are involved in determining health and disease, but it's how those genes interact with environmental and lifestyle provocations. So some of us like to say that genes essentially load the gun and the environment pulls the trigger. In other words, a very important interaction between genetic susceptibility to the disease and then the requirement for certain environmental factors to be present in order for the disease to be manifested.
When you talk about veterans giving blood, I assume, to collect this information, is there any risk associated with participating in the program?
So to volunteer in the study is very easy. It takes about 20 minutes, and it really involves just a few questions and then a blood draw. And the risk associated with this particular study are essentially the minimal risks associated with blood drawing. A little bit of discomfort, the blood is drawn out of the arm from a vein in the arm, potentially some slight bruising, and very rarely potentially infection.
Dr. Schuldiner, what are the benefits to veterans participating in this study?
Well, we'll be collecting blood samples from 1 million veterans, and there aren't any direct immediate benefits to veterans who volunteer in this study. But the benefit of knowing that you're involved in probably the largest research initiative that the VA has ever put forth, and also the idea that discoveries made downstream from utilization of this resource will lead to new therapies are the main benefits that veterans can afford from participating in this study.
We're going to go to a break shortly, but we want to be sure that veterans understand that their information will be safeguarded. Could you explain the safeguards that are in place in this program?
Yes, absolutely. That's a great point. Certainly we don't want our medical information, nor do we want our genetic information broadcast outside of places outside of the VA. And so really a number of safeguards have been taken to guard that secure information. Certainly the electronic health record is very secure, and using very similar approaches, the DNA as well as the information that we glean from the DNA will be safeguarded.
Thank you so much for joining us for today's show. I'm sure that we've piqued the interest of some veterans, and most of our veterans are very service-oriented, and I've heard some of them just say, I'd like to help, I'd like to participate. So thank you so much for joining us today.
You're welcome. It's a pleasure to be here.
We're going to take a short break, but when we return, we'll have more about the Million Veteran Program, so please stay tuned.
The foundation for human life is found within DNA. The study of DNA has provided many clues as to the role of genes in disease and the way genes and our environment interact.
The Veterans Affairs Research and Development Program has launched the Million Veteran Program, or MVP, an important partnership between VA and veterans to learn more about how genes affect health and thus transform healthcare for veterans and for all Americans.
The purpose of the Million Veteran Program is to create this research resource which researchers can tap into to get genetic information and associated health information, military exposure information, and lifestyle information all together in one comprehensive database, and conduct research that will help lead to discoveries which we then hope will translate to improved care for veterans and also for the population at large.
This is not about just getting by with the veterans. This is giving the veterans the very best we can do, because they gave us their very best. So it's about the obligation that we owe them. And we owe it to them not just because they served, but because they were willing to serve. And they allow us these opportunities. We need to give them absolutely the best we can. And I think this program is going to do that.
We're very lucky in the VA to have such a population that's willing to step forward and to help us, help them, and help others.
If you are a veteran who receives care through the Veterans Health Administration and would like to be a part of transforming healthcare for the 21st century, visit the Million Veteran Program website or call 866-441-6075.
Welcome back to Veterans Health Watch. To continue our discussion on the Million Veteran Program is Gabrielle Gill, the research coordinator for the Million Veteran Program at the VA Maryland Healthcare System. Gabrielle, thank you so much for joining us.
Thank you for having me today.
In a previous segment, our guest described a lot about the Million Veteran Program, but could you tell us who's eligible to participate?
Sure. So any veteran who receives health care here in the Maryland VA healthcare system is eligible to enroll in the Million Veteran Program.
Mm-hmm. And Gabrielle, how are they being invited to enroll in the program?
So we have a national mail center who's sending out invitational packets to our veterans. The invitational package includes a letter, information about the study, and also the baseline survey. The way that the system is set up is because we have so many thousands of veterans, nearly 50,000 veterans who receive health care here. We're actually about every 6 months sending out about 4,000 or 5,000 invitational packets. So over the next 5 to 6 years, each of our veterans will be invited to participate. They'll receive this packet in the mail and be invited to participate in the Million Veteran Program.
How is the program structured throughout the country?
So the Million Veteran Program has 2 coordinating centers throughout the country. One is at the Boston VA and the other is at the West Haven, Connecticut VA. And then right now we have 40 enrollment sites throughout the country, and each of these enrollment sites are charged with enrolling about 20,000 veterans over the next 5 to 7 years.
It's a big charge.
Yeah. Yes.
Gabrielle, if a veteran's interested in participating in this program, what's involved on their end?
So participation involves filling out surveys. There's a baseline survey, and then there might be additional ones in the future. Coming into our enrollment office, which is located at the Baltimore VA Medical Center on 10 North Green Street in room 4B, room 210. They come in for about 20 minutes to meet with us, which at that time they get their blood drawn for genetic analysis. They allow select MVP staff members to have ongoing access to their medical records. And then they also allow for future contact from the Million Veteran Program.
And Gabrielle, I understand that you're not only the research coordinator for the local site for the program, but you're a veteran who also participates in the Million Veteran Program. So give us that perspective.
Yes, well, I was pretty surprised. I received my health care here as well. And a couple of months after I came on as the research coordinator for the program, I received my invitational mailing. And so I decided that, this was a really good opportunity to give back to the veterans community. It's pretty easy to participate. It doesn't require a lot of time or effort on our part as a participant. And also being a female veteran, I think it's pretty important to have the female veteran population represented in the study. And also being stationed in various places around the world, it just kind of brings a unique aspect to the study. So when I received my invitation, I decided, there's really no negatives to not participate in the study.
Gabrielle, I understand there's a lot of vets who are participating, and there's probably many who are watching who are considering participating, but may have questions about how we're assuring the confidentiality of their information. Can you tell us about some of those measures that are in place to help assure their confidentiality?
Yes, so one of the big things that we have in place with our program is that each of our veterans are assigned a research study number, and that serves as their code throughout the research program. So their medical information, their blood, and their surveys are coded with this number. So we remove the veterans' names, addresses, social security numbers from our research databases, so that way there's not a direct link or veterans can't be identified. We also don't put information in their VA medical records. We encourage our veterans to tell whoever they like and spread the word that they are part of our program. But if anybody comes back to ask us, including their health care providers here at the VA, we're not allowed to confirm that they are enrolled in the program. And then we also have what's called a certificate of confidentiality in place with the government. So if our program gets subpoenaed, or if we get Freedom of Information Act requests or requests from another government agency, to have access to our information. We are actually exempt from releasing even our veterans' names in those cases.
That sounds pretty safe. It's good to know. So, Gabrielle, could you tell us why should a veteran participate in this program?
Well, I think it's a great opportunity for our veterans. You know, we like to take care of other veterans. You know, eventually we will have a global impact on healthcare with the findings from our research. It's very easy to participate, and we are, you know, a unique population. As Dr. Schuldiner said, we have medical records that we can follow our veterans' healthcare long term. If they move out of state, we can continue to follow their health care so we don't lose them in the moving process. In addition, you know, we come from all over the world to be a part of our military. So a lot of these environmental causes and environmental links to illnesses that might not have been picked up otherwise, we could be able to pick that up. And then we are also stationed all over the world. So, you know, we're just a pretty unique population to be able to do this type of research with.
Yeah. Gabrielle, how do eligible veterans go about enrolling in this program?
So veterans can come into our clinic. They could actually walk in while they're in the hospital. Again, we're in 4B, room 210, down here on Green Street. Veterans can also call our information center number. It's a toll-free number. And they can also call to schedule an appointment, so that way while they're already down here, they're guaranteed an appointment slot. And then they can also visit our website and to get more information, and then it also has phone numbers to call to set up appointments to come in to see us.
Gabrielle, you mentioned that you're located, or the program central office is located at the Baltimore VA Medical Center. But I want to make it clear for our veterans who use VA facilities throughout the state that they can also come down to Green Street in Baltimore and sign up for the program.
Yes, they can actually walk in and come in to see us or schedule an appointment. We've also just received approval to be able to go out to other medical centers like Perry Point, to other outpatient clinics like Loch Raven, Glen Burnie. So right now we're working out the logistics of doing that. So within the next few months we'll be coming maybe once or twice a month to these facilities. So that way it's easier for our veterans to enroll in the program, so we can actually come to them and save them the travel from coming down to Baltimore.
That sounds great, Gabrielle. Thank you so much for joining us for today's show and explaining more about this new initiative, the Million Veteran Program.
Thank you for having me today.
Well, that wraps up this edition of Veterans Health Watch. If you have questions about today's show or would like to make suggestions for future topics, please call us at 1-800-463-6295, extension 7101, or visit us on the web at maryland.va.gov. You can also follow us on Facebook and Twitter.
And if you are a veteran or you know a veteran who would like to enroll for VA healthcare, please stop by the medical center, call us, or join us online. We look forward to hearing from you soon, and please join us next time.
Have you ever wondered how you could support the needs of our nation's veterans? The VA Maryland healthcare system has a number of opportunities for community members and local businesses to support the needs of hospitalized veterans throughout the state. Through your tax-deductible donation, you can help to enhance the care and service provided to Maryland's veterans. For more information, contact us at 1-800-949-1003, extension 5409. You too can show our nation's veterans that they have not been forgotten.
Does the thought of going to the pharmacy, standing in a long line, and paying high costs for your prescriptions worry you? Well, the VA Maryland healthcare system provides a full array of pharmacy benefits, including 2 full-service pharmacies, convenient online and phone and prescription refill services, and reasonable medication co-pays for enrolled veterans. To refill or check on the status of your current prescription with the VA Maryland healthcare system, call 1-800-463-6295, extension 7395, 24 hours a day, 7 days a week.